Hi, everyone. Thank you again, everyone, for the support, for the questions. We got several questions related to mostly to COVID, and that's not surprising looking at the news, and specifically about vitamin C. A lot of people use vitamin C and they have questions how to use it. Is there any proof? Is there any science? Is there any evidence that it works? It boosts your immune system, and how to go about it. This is the topic of this video.
Hello, my name is Merwin Smith, and I've been coming to Dr. Mongolian's office for about almost 2 years. And his pain management is awesome. The shots really help my arms, and I recommend anyone to come here.
My name's Virginia Bowers. I have been coming to Dr. Margolin's for, about 2016 when I came here. I love this office. I love being Dr. Margolin's patient. They serve me well, and I'm feeling better every time they treat me.
Hi, my name is Angie, and I've been coming here since 2011, and I've had a lot of back pain, but since I've been coming here, it's been controlled, and I'm very happy and pleased with coming to this doctor.
Yes, my name is Christopher Hawkins, and I've been coming to Dr. Margolian for about 5 years. I have pain on my whole left side, my left leg and left arm. His treatment has been tremendously good for me. It's helped me a lot. You know, I can get the treatment and go for a whole month without any interruptions. And everything goes fine, you know. I have only the best things to say about the doctor.
Well, let me first discuss a few things about vitamin C. Vitamin C has been around for a very long time. And you don't need meat generally to know that vitamin C boosts your immune system. Many people reflectively take vitamin C when they get flu. Very few people actually understand how it works, and it works on several different levels. Vitamin C, as you know, is involved in multiple functions in your body. You may know about scurvy. That's when you're deficient in vitamin C. Classically, when people traveled by ship hundreds of years ago and they ate the same limited ration of food without fruits, or traveled to, very remote and difficult locations like far north, they develop scurvy. So we know it can, the deficiency in vitamin C can be very detrimental to your body. Now, what about boosting vitamin C? How it can help you? Actually, it can help you in several different ways. I'll just not only want to mention our work. I want to mention this article in the Clinical Immunology. I'll put a link in the description of this video. It talks about individual risk management strategy and potential therapeutic options for the COVID-19 pandemic. Well, published a while ago, a few months ago, and it actually talked about options that are not identical to what we suggested a while ago, but there are same components. There is, same, I would say, strategy independently on us. So they talk about vitamin C, and they say that there are several studies that show that pneumonia or respiratory diseases can be decreased, or the frequency or the chance can be the chance is lower and the severity is lower according to some studies. And they say, furthermore, 5 trials with 598 participants showed that vitamin C decreased the risk of common cold without any adverse effects. Vitamin C supplementation is thus the sensible option to prevent and support the immune responses in the micronutrient deficient individuals at risk for COVID-19. So they make this claim about people who they say micronutrient deficiency, but they don't specify if you need to be deficient in vitamin C to get this effect, how you measure the levels of vitamin C, what considered to be deficient. Let me share with you our experience, and then I would talk about what you practically can do about supplementing vitamin C. First, few words about what the mechanism of action of vitamin C. Vitamin C works on something what we call cellular immunity, right? There is humoral, there is immunity related to antibodies, and there is immunity related to immune cells, mostly lymphocytes, and specifically NK cells. These are the so-called killer cells that actually killed abnormal cells in your body, and there is some evidence that vitamin C can enhance them. Why is it so important? Everybody talks about vaccines and different types of antibodies, and this is very important. Having said that, the antibodies, as you know, they can rise and fall. Not all viruses can be protected by antibodies. Like you can get great antibodies for HIV, but it doesn't protect you. There are certain antibodies that protect you to some extent, and if the virus mutates, then you need new antibodies on many occasions to completely protect from the new mutation. Also, the memory is much shorter. The immune memory for antibodies is much shorter than cellular immunity. I would like to mention an interesting study, in my opinion, that is not for whatever reason discussed enough in the literature. They pulled blood from blood bank between, I believe, years 15 and 18, way before COVID. And they separated lymphocytes, the cellular immunity, and it showed that these lymphocytes, 40% of them attacked the virus, attacked COVID-19. Maybe that's why about 40% people are asymptomatic. It means that there were other viruses. By the way, coronaviruses can cause common cold, or maybe exposure to other viruses, and immunization can train your immune system. And that's why you want to enhance those cells with vitamin C. By the way, there was my understanding, there was a study on 11,000 patients by Cleveland Clinic that actually showed that people who got pneumonia vaccinations or other vaccinations supposedly or allegedly have less chances to get COVID. And that basically supports this idea. In addition, vitamin C improves collagen synthesis, mostly with amino acids proline and lysine, and it's good to know because L-lysine can be bought over the counter. It's fairly benign. You can take it together with vitamin C. In the last part of this video, I'm going to talk how we supplement vitamin C. All right, so we decided it's not a bad idea to supplement vitamin C. I believe Dr. Fauci mentioned he takes it. So how you do that? There are several options. Classically, you can get capsules. You can get tablets, like I believe these are tablets. It's called sustained release. You can get chewable tablets, or you can get powder actually. There is special junior vitamin C, which is a chewable tablet for kids. And the question is, how much is reasonable to take? Now, I want to tell you that there is experimental treatments with IV, intravenous administration of vitamin C, which may or may not work, but they're out of scope of this discussion. You can't put IV for yourself. And obviously, before you consider anything of that kind, you need to consult your physician. But we're talking about regular over-the-counter oral supplementation. Is more vitamin C better? Yes, to some extent. What are the limitations? First, if you go above certain levels, I would say about 3 grams a day, you can develop diarrhea. It depends on how sensitive you are. If you develop diarrhea, you get dehydrated, and honestly, it can scare you, primarily if you're concerned about COVID. Sometimes COVID manifests itself as diarrhea or GI symptoms, and you don't know if it's related to vitamin C or it's related to COVID. So we don't want that. Secondly, people who have stones, kidney stones, mostly something called oxalate stones, can get worse with vitamin C. These are the two major limitations. So I think it's fairly reasonable for an adult to take 1 gram vitamin C, and I would say 2 grams maybe a day if you have symptoms or concerns. Talk to your doctor before doing that. I would not increase more than that unless you're guided by a physician. How to supplement it? I don't think there is a huge difference between whether you take regular tablet, capsule, chewable tablet, something they call sustained release. It could be mixed with rose hips. It could be sometimes in combination with some other vitamins, and you need to see and obviously decide on whether you need them. You can supplement it as a powder if you know how to dose it. I don't think there is a huge difference on what preparation you use, as long as it's a reputable source of vitamin C. This is very reasonable. I like, as I showed in the past, I like this stamp here, GMP, which is quality assured. It's called quality assured. Yeah, just here. I'm not sure you can see it, but this stamp says quality assured GMP or something of that kind. It means that somebody looked at that. It's not obviously FDA regulated, but you just want to make sure it's a real vitamin C, which is most of the time. Our experience is that taking vitamin C is reasonable. It will not prevent you from getting the virus. You can get the virus primarily alone. It makes sense to take with other supplements, like we discussed before, with zinc, quercetin, with vitamin E and vitamin D, which we will discuss later. The hope is that if you do get the virus, you would be in better shape to fight it. And the studies are going. So I hope it answered the question. Sorry we had some delay with videos because everything which is going on, but we appreciate your questions, we appreciate your support, and we hope everybody stays safe and healthy and do well. Thank you.